Welcome to Tea with the Experts and Dr. Leah Merle, your premier destination for mental health insights, empowerment, and inspiration. Led by the passionate therapist and counselor educator, Dr. Leah Merle, this interview-style podcast delves deep into diverse themes with top-notch experts in the field. Beginning with the What Is series, from anxiety, trauma to resilience and mindfulness. We sip our way through captivating conversations, psychological insights, shedding light on the complexities of mental wellness and what it means to be a human being. Each episode serves up a refreshing blend of knowledge, empathy, and empowerment, aiming to destigmatize mental health issues and raise awareness in an engaging and approaching manner. But before we dive into our discussions, let's take a moment to appreciate the tradition of tea time. Originating in England during the 19th century, tea time became a cherished ritual for British society. And speaking of British traditions, our very own Dr. Leah Merle is a British expat who now resides in the USA. She brings with her not only her expertise in mental health, but also a deep appreciation for the therapeutic power of tea time. So grab your favourite cuppa and get ready to sleep yourself into transformative conversations that will leave you feeling uplifted and enlightened. Subscribe now and join the movement to break down barriers and foster a more compassionate world.
Welcome to the premiere episode of Tea with the Experts. I'm Dr. Leah Merle. I'm your host and guide through the fascinating world of mental health. So today, hang on to your hats, everybody. We're diving into a topic that's often shrouded in mystery. Therapy, counseling, family therapy. Replace that with any word that you want. The thought of going into counseling and gaining therapy, right? In this special, we focus on the What Is series. So we're going to be answering common search questions from the internet that people really want to know, but are just super afraid to ask. So what I'm hoping is that you will join me, grab your favorite cuppa, and let's dive in. Let's explore those first questions. So one of the questions that came up in my research for this podcast is, what is therapy? So that is going to be our first question. But the historical force that's shaped therapy in the field that we know it is really important too, I think, as a foundation. So let's explore the concept of a bottom-up approach, it's called in the field, versus a top-down perspective. So traditionally, therapy has often been approached from more of a top-down perspective. So it's been focused on cognitive processes and beliefs and thoughts as a means of really addressing emotional and behavioral challenges. However, what we found through research in recent years is there's really been a growing interest in a bottom-up approach. So that really emphasizes the importance of bodily sensations, emotions, physiological responses in therapy. This approach recognizes the interconnectedness of the mind and the body, and it really seeks to integrate somatic techniques such as mindfulness, breath work, and body awareness into the therapeutic process. Both top-down and bottom-up approaches have their merits, of course, and it's about perspective. And the most effective therapy often involves a combination of both. It's the both and of the situation. By integrating cognitive and somatic techniques, therapists can help clients really develop a deeper understanding of their own emotions and their own experiences, while fostering greater self-awareness, self-reflection, as well as internal resilience. So now, at first, why don't we address some questions that have come up in my research for this initial podcast? The questions have really come up about the therapeutic process. So the first question that came to me is, hi, Dr. Leah. I've been considering therapy for a while, but I'm really not sure where to start. So how do I know that therapy or counseling is right for me? So my answer to this, my response to this is, it's a brilliant question. It really is a brilliant question. Therapy can be beneficial for anybody seeking support and guidance. So whether they're dealing with specific challenges, simply striving for internal personal growth, maybe the individual is experiencing distressing symptoms, struggling to cope with external stresses, maybe internal stresses, or just feeling a sense of stuckness and maybe participating in unhealthy patterns. So I think that in those cases, therapy really is a very helpful source and it can be very therapeutic. It's also important to consider your readiness and willingness to engage in the therapeutic process. And that is always going to be individualized based on the person regarding the context of their environment, where they are. Do they have the supports? Do they have the resources? Do they have the finances? Whatever the case may be. And really, ultimately, if you're curious about therapy and open to exploring it further, I really encourage you to reach out to a qualified therapist to discuss your options. There are a lot of great, phenomenal clinicians out there that are just willing to help. And if they feel that they can't help you individually in your signs and symptoms, they're going to refer you to somebody that can. So another common question that's come up is, what are the types of therapy that are available? So I had a question and they shared with me, hi, Dr. Leah. I've heard about different types of therapy, but I'm really not sure which one would be best for me. And can you explain the differences between them? So there are numerous therapeutic approaches. Basically, we've just talked about bottom up versus top down approaches. But each individual approach, or modality as I like to call them, is really tailored to address specific issues and suit individual preferences. So some common types include cognitive behavioral therapy, or CBT for short. And that really is a modality that focuses on changing negative thought patterns as well as behaviors. There is psychodynamic therapy, which really focuses on exploring the unconscious influences on behavior as well as emotions. There's mindfulness-based therapy, which emphasizes the present moment, the here and now, with the awareness and acceptance that goes with that. And then really, truly, the key is finding the approach that resonates with you and aligns with your goals for therapy. That's really, really important. Another question that I got is that an individual had been considering therapy, but they're really concerned about the cost. So they asked me, how affordable is therapy? And are there options on those who are on a tight budget? This is a great question. It's a really important consideration. I know for me personally, the therapeutic process is expensive. And the cost of therapy can vary depending on factors such as geographical location, whether you're rural, whether you're more city-oriented, therapists' qualifications, what type of license they have in the state that you're residing in, and the types of therapy as well. So while therapy can be expensive, there really are alternative options available for those on a tighter budget. Sometimes clinicians offer a sliding scale fee based on income. And then also there are some really phenomenal community mental health centers and nonprofit organizations that have licensed, qualified clinicians who are providing low cost or free therapeutic services. Also, the other additional element to this is that some employers offer employee assistance programs, or EAPs, that provide counseling services at no cost to employees. It's really worth exploring options and discussing affordability with potential therapists to find the best fit for your needs and your budget. And so definitely ask the therapist what they're willing to slide towards. And there are different low-cost websites out there as well that you could take a look at to see if there's a therapist that really fits your need. And now people meet in person, they meet in their office. They also sometimes have a hybrid schedule where there'll be remote work or telemental health, as we call it in the field, which is in the convenience of your own home. Another question we often hear as professionals is, how effective is therapy? And so this question came up, which I thought it was a really good one. Dr. Leah, I've been hesitant to try therapy because I'm not sure if it really works. That's a very honest question. Can you provide any evidence or statistics on the effectiveness of therapy? Absolutely. So research consistently shows that therapy can be highly effective in treating a wide range of mental health issues. And according to a specific meta-analysis published in the Journal of Clinical Psychology, therapy is significantly more effective than no treatment for individuals with depression, anxiety, as well as other common mental health issues. Additionally, studies have found that therapy can lead to improvements in overall well-being, interpersonal relationships, as well as quality of life. So it's really important to remember that therapy is not a quick fix, and outcomes can vary depending on those factors, such as the type of therapy it is, the therapist-client relationship, therapeutic rapport, as well as the client's level of engagement. So, however, I think it's important to note that with commitment and perseverance, therapy really can be a powerful tool for personal growth and healing. And so before we conclude today's episode, I wanted to share a little story with you. It's a common belief in the therapy world, in my world that I reside in, that all the best therapists have therapists themselves. Now, if you're a therapist and you feel outed by this, I apologize ahead, but I'm not sorry, because I really do truly believe this, that to be able to understand the therapeutic process, therapists need to have sat on the other side of the seat. They need to have sat in the seat on the other side of the room. It's just as important as being a trained, effective, researched, experienced clinician that's providing guidance. It's really a reminder that we're all human. We really are. And we have our own struggles and challenges to navigate. So seeking therapy is not a sign of weakness. It's a proactive step forward of self-care and growth. And really, in fact, preventative mental health care is adaptive. It's the healthy option. Just as we go to a doctor or a primary care physician to check up, to get our checkups, to maintain your physical health, therapy can serve as a checkup for our emotional well-being, helping us build resilience and really cope with life's ups and downs. So please send in your questions. I would love to be able to answer them. As we move forward through this What Is series, I am going to be talking with experts about certain topics and certain areas. But if you have a specific topic that you'd like me to delve into, please don't hesitate to reach out, email me, and I will be able to organize that episode happily for you. If you'd like to reach out to me regarding a question that you have for me or a topic for another episode, please reach out to Dr. Leah Merle. That is DrLeahMerle at teawiththeexperts.com. That is Dr. Leah Merle at teawiththeexperts.com. So as we start to wrap up today's first inaugural episode, I want to leave you with this thought. If I can kind of boil it down into a nutshell, therapy is a journey of self-discovery and growth, and it's really supposed to be a safe enough space to explore your thoughts, your feelings, emotions, and experiences that you've been through. And it's guided by a trained, licensed professional in the state that you reside in, where they are there to support you every step of the way. The therapeutic relationship is so, so incredibly important, and therapeutic rapport is everything. If it's not a good fit for you, please find another clinician. And it takes a little while to get into a groove, maybe a couple of sessions. But by the third, fourth session, if you're not feeling it with the clinician, then you really should ask them for referrals to other clinicians that might be a better therapeutic fit for you. So I want to thank you for joining me on this enlightening exploration of what is therapy. And this is my perspective of the beginnings of therapy and their approaches. And I really hope you found the conversation informative and inspiring. And as we close this inaugural episode of Tea with the Experts, I really want to leave you with a reminder that seeking therapy is an active act of courage and self-compassion. It takes courage to dedicate yourself to the therapeutic process. It's a journey of self-discovery. It's a journey of growth. And it's really okay to ask for help and support and resources along the way in this journey that we call life. So just remember you're not alone, and there is hope and healing available to you. So whether you're considering therapy for the first time or you're a seasoned therapy veteran, I really encourage you to approach this process with an open heart and an open mind. Embrace the opportunity to explore, learn, and grow, and just know that you're worthy of the support and guidance that therapy can provide for you, and it does for many, myself included. So from me, your host, Dr. Leah Merle, thank you so much for joining me on this journey today. Please be sure to subscribe to Tea with the Experts and Dr. Leah Merle for more insightful conversations about mental health and wellness. So until next time, take care of yourselves and each other. Goodbye for now.